we're going to discuss the skull, no? Identify important structures, and then mention or discuss some important clinical correlates related to the structure. So the skull is composed of the cranial bones. The cranial bones will form the compartment for the brain and other structures that are found inside the cranial vault. And then we also have the facial bones that form the face. So for the large bones, very easy to identify. We have the frontal bone, parietal, the temporal bone here, occipital bone, and for the visible facial bones, we have the maxilla, the nasal bones, zygomatic bone, and the bones that are still part of the cranial bones, but are found deep in the cranium. We have the ethmoid here and the sphenoid bones. So equally important, you can identify suture lines. The suture lines of the skull. We have the coronal, sagittal suture, squamous suture right here, and we have the lambdoid suture right there. So in a few areas here in the skull, you have important areas where bones and suture lines meet. This H-shaped meeting point of suture lines and cranial bones, we call this area the Therion, P-T-E-R-I-O-N. So the Therion is the meeting point of the sphenoid, frontal, parietal, and the temporal bones. Clinical significance, that is the one of the weakest points of the skull. Any blow or traumatic force applied here, it can the area or the bones in the area can easily fracture, and there is an artery, the middle meningeal artery, which is a branch of the maxillary artery. It crosses this area. It's closely related to the Therion, and it is commonly injured when there are fractures on this part of the head. So on the posterior end of the squamous or squamosal suture, we have here another meeting point of suture lines and bones. This is called the asterion, A-S-T-E-R-I-O-N. So the skull has suture lines. They are classified as joints, but non-movable or non-synovial joints. So in the fetal head, in the fetal anatomy, these suture lines and cranial bones are not fused. It is so for the reason that the fetal head should be the fetal head should should allow some molding or compressive force, no, to be applied on it. And that is the ability of the fetal skull to accommodate molding is important during labor and childbirth, because the birth canal is, although it is stretchable or expandable, no, the muscles forming the birth canal can it can actually subject, no, the fetal head to compressive forces, and the fetal head should should be allowed to absorb some of these forces, no, and that process is called molding. So the fetal head should allow some degree of molding and compression as it passes through the birth canal during childbirth. So right after birth, the suture lines are still unfused, but there is a fibromembranous structure, no? The skull is not completely or totally open or broken. You have fibromembranous structure, no, in the areas where the suture lines will fuse and meet up later. So after birth, the suture lines are still there, and they will allow room for brain expansion and brain growth. So aside from the non-fused suture lines, there are also areas, no, or big gaps, no, in between the skull bones. No. The biggest would be at this area right here. We can also call this part the bregma. So the big gap in between the frontal and parietal bones in this area, that is called the anterior fontanelle of the skull. At the posterior end of the parietal suture, no, where it meets up with the lambdoid suture, there is also a posterior fontanelle back here. Excuse. And laterally, at the area of the Therion and area of the Asterion, now we have the anterolateral or the sphenoidal, no, fontanelle right here, and we have the posterolateral or the mastoidal fontanelle back here. So the anterior fontanelle is the most clinically important of the fontanelles, and it is the last fontanelle to close. Closure time of the anterior fontanelle occurs at around 18 months up to 24 months age of our infant. So clinical importance of the anterior fontanelle, it in the infant, no, it allows us to assess the hydration status of our patient. Sunken fontanelle implies dehydration. Bulging fontanelle, on the other hand, will signify there is increased intracranial pressure inside the cranium.